The number of babies born suffering from withdrawal symptoms due to their mother's use of prescription painkillers during pregnancy more than tripled between 2000 and 2009, according to the new study published in the Journal of American Medical Association. So what does it mean for a baby to be born with withdrawal symptoms? For those of you who don't know, you're the reason why I will be speaking about early childhood development today. Neonatal abstinence syndrome, also known as NAS, is the term used for the group of problems babies experience when their mothers abuse drugs while they're in the womb. Almost every drug can pass from the mother's bloodstream to the placenta to the baby, pretty much passing down whatever addiction that the mother has. If it doesn't kill the baby before it's born, the baby comes out dependent on the drug and suffers from withdrawals just like a typical drug addict would. In addition to this, the baby can also suffer from poor intrauterine growth, premature birth, seizures, and a wide range of potentially life-threatening birth defects. Many children are born with diseases and disabilities that could have been prevented, avoided, or at least helped be less harmful. With this being said, individuals who want to get pregnant or are expecting a child should learn more about early childhood development. Last semester, I had the opportunity to take a course called Early Childhood Development. I spent many weeks reading, researching, testing, and observing what happens to a growing child from conception to age 8. The reason I'm talking about this is because I want to persuade my audience to learn more about early childhood development. Today we will discuss early childhood development, specifically what it is, what expecting mothers should know, and how the parents can affect the child before it's even born. Early childhood development is the growth of a child from conception to age 8. A typical pregnancy lasts around 9 months, which is divided into 3 trimesters. The first trimester is the most crucial. This is where the baby's body structure and organ system are developed. You can hear the baby's first heartbeat at around 10 weeks. From there, the baby grows and develops until it's ready to be born about 30 weeks later. An expecting mother should be doing her part in a pregnancy to promote a healthy baby. There is so much more than just carrying the baby. Examples are taking prenatal vitamins, eating healthy, meaning focusing on tons of fruits and vegetables, and avoiding caffeine such as Cokes or chocolate. Going to regular doctor visits are part of keeping up with not only the baby's health, but the mother's as well. During pregnancy, many doctor visits are to be scheduled and made. As you get closer to the end, or if there are complications with the pregnancy, the more frequent the checkups will get. Many different tests and checks will be done to look at how well the baby is developing. Some examples are ultrasounds, blood tests, or amniocentesis, which is the test that determines whether your baby has Down syndrome or other abnormalities. It's like previously mentioned, a mother affects her baby more than she probably realizes. If she smokes or drinks during pregnancy, she can cause the baby to be fighting for its life the second it's born. When a baby is born from a mother who drank alcohol during those crucial 9 months, fetal alcohol syndrome is a possible result. According to WebMD, fetal alcohol syndrome can result in the failure of heart, kidneys, and bones developing, learning disabilities and a low IQ, and many more symptoms. When a mother smokes while being pregnant, she usually ends up with the baby being born too early, born too small, and the baby dying before it's even born. These are just 2 examples of the many diseases that the mother could have prevented if she had chosen to give up her addictions to save her baby's life. So after we have discussed what early childhood development is, what expecting mothers need to know about it, and how she can affect her baby before it's even born, I hope you realize that enough information on early childhood development will never be enough. A baby's life matters more than a cigarette or a beer ever could. So before one last smoke and one last drink, ask yourself if it's worth taking your unborn child's one last breath. I know what my answer is. What's yours?